1. A nurse is caring for a patient with Clostridioides difficile infection. Which of the following is the most appropriate hand hygiene method after removing gloves? 1. Alcohol-based sanitizer. 2. Antimicrobial foam. 3. Soap and water. 4. Antibacterial wipes. Answer: soap and water. Rationale: alcohol-based hand sanitizers are ineffective against C. difficile spores. Hand washing with soap and water is required. 2. A nurse prepares to administer oral medication to a patient on neutropenic precautions. Which action is most appropriate to prevent infection? 1. Use a mask and gloves. 2. Provide freshly prepared food. 3. Wash hands before entering the room. 4. Perform sterile technique. Answer: wash hands before entering the room. Rationale: hand hygiene is the first and most important step in preventing transmission to immunocompromised patients. 3. While caring for a patient in airborne isolation, which intervention takes priority? 1. Ensure food is delivered outside the room. 2. Keep the room door open for airflow. 3. Wear an N95 respirator mask before entry. 4. Use contact precautions only. Answer: wear an N95 respirator mask before entry. Rationale: airborne precautions require an N95 respirator to prevent inhalation of infectious particles. 4. Which action by the nurse reduces the risk of a catheter-associated urinary tract infection, CAUTI 1? Irrigating the catheter daily. 2. Inserting the catheter using clean gloves. 3. Securing the catheter to prevent movement. 4. Changing the catheter weekly. Answer: securing the catheter to prevent movement. Rationale: preventing catheter movement minimizes urethral trauma and the risk of introducing infection. 5. A nurse is assigned to 4 patients. Which patient should be placed in a private room to prevent infection transmission? 1. A patient with a stage I pressure injury. 2. A patient with bacterial meningitis. 3. A patient with controlled diabetes. 4. A patient recovering from surgery. Answer: a patient with bacterial meningitis. Rationale: meningitis requires droplet precautions and a private room to avoid exposing other patients. 6. Which statement by a nurse caring for a tuberculosis patient requires correction? 1. I must wear an N95 respirator. 2. The patient should wear a surgical mask during transport. 3. I can dispose of my mask in a regular trash bin. 4. I need to wear sterile gloves in the room. Answer: I need to wear sterile gloves in the room. Rationale: clean gloves, not sterile gloves, are appropriate unless performing a sterile procedure. 7. A nurse is preparing to assist a surgeon with a central line insertion at the bedside. Which is the most critical infection control measure? 1. Wearing goggles. 2. Using clean gloves. 3. Maintaining sterile technique. 4. Placing a surgical mask on the patient. Answer: maintaining sterile technique. Rationale: central line insertion requires strict sterile technique to prevent bloodstream infections. 8. A nurse is caring for a patient with herpes zoster shingles with disseminated lesions. Which infection control precaution is required? 1. Contact only. 2. Droplet only. 3. Airborne and contact. 4. Standard only. Answer: airborne and contact. Rationale: disseminated shingles require both airborne and contact precautions due to the high transmission risk. 9. What is the appropriate action if a sterile item's expiration date cannot be read? 1. Use the item if the packaging looks intact. 2. Mark it with today's date and use it. 3. Ask the charge nurse for permission to use it. 4. Discard the item and obtain a new one. Answer: discard the item and obtain a new one. Rationale: if sterility is in doubt, the item must be considered contaminated and should not be used. 10. A nurse is preparing to enter the room of a patient under droplet precautions. Which item is essential? 1. N95 mask. 2. Face shield. 3. Surgical mask. 4. Gown and gloves only. Answer: surgical mask. Rationale: droplet precautions require a surgical mask to prevent inhalation of large respiratory droplets. 11. During a wound dressing change, the nurse accidentally touches the sterile gauze with a non-sterile glove. What is the appropriate response? 1. Continue the dressing change. 2. Replace the sterile gauze. 3. Apply antibiotic ointment instead. 4. Disinfect the gauze with alcohol. Answer: replace the sterile gauze. Rationale: once contaminated, the gauze must be replaced to maintain aseptic technique. 12. Which action by a nurse demonstrates correct infection control during blood glucose monitoring? 1. Using the same lancet for multiple patients. 2. Using alcohol swabs on the device between uses. 3. Using single-use lancets for each patient. 4. Wiping the glucometer with a dry cloth. Answer: using single-use lancets for each patient. Rationale: sharing lancets increases the risk of bloodborne disease transmission. Use a new lancet for each patient. 13. A nurse is educating a patient on preventing surgical wound infection after discharge. Which statement indicates effective teaching? 1. I will clean the wound daily with peroxide. 2. I can touch the wound with bare hands if clean. 3. I'll wash my hands before changing the dressing. 4. I don't need to report mild swelling. Answer: I'll wash my hands before changing the dressing. Rationale: hand hygiene is the most effective way to prevent surgical site infections. 14. Which action should the nurse take when a sterile field is left unattended? 1. Cover it with a sterile drape. 2. Continue using it if it appears untouched. 3. Consider it contaminated and reestablish a new field. 4. Ask another nurse to verify sterility. Answer: consider it contaminated and reestablish a new field. Rationale: a sterile field is no longer considered sterile once left unattended. 15. Which patient situation requires the nurse to wear protective eyewear? 1. Administering oral medications. 2. Irrigating a wound. 3. Assessing a stage eye pressure ulcer. 4. Applying a condom catheter. Answer: irrigating a wound. Rationale: wound irrigation may cause splashes of body fluids, requiring eye protection. 16. A nurse is providing care for a patient with MRSA in a wound. What infection control measure is necessary? 1. Droplet precautions. 2. Contact precautions. 3. Airborne precautions. 4. Neutropenic precautions. Answer: contact precautions. Rationale: MRSA spreads via direct contact. Gowns and gloves are essential when entering the room. 17. A nurse educator reviews infection prevention with new hires. Which example reflects a breach of standard precautions? 1. Wearing gloves for oral suctioning. 2. Recapping a used needle. 3. Wearing a gown for wound care. 4. Using hand sanitizer after removing gloves. Answer: recapping a used needle. Rationale: recapping needles increases the risk of needle stick injuries and should be avoided. 18. A nurse notices a colleague not washing hands between patient contacts. What is the best initial response? 1. Report to the Infection Control Committee. 2. Confront the nurse angrily. 3. Calmly remind the nurse to wash hands. 4. Document the incident in the chart. Answer: calmly remind the nurse to wash hands. Rationale: addressing the behavior immediately in a respectful manner promotes accountability and patient safety. 19. What is the most appropriate way to transport a specimen from a contact isolation room? 1. Use a sealed, labeled bag. 2. Carry it in a clean glove. 3. Place in a cloth container. 4. Hand it to the lab staff directly. Answer: use a sealed, labeled bag. Rationale: transporting specimens in a sealed bag prevents contamination and ensures safe handling. 20. A nurse is caring for a patient with severe neutropenia. Which items should be restricted from the room? 1. Electric razor. 2. Bottled water. 3. Fresh flowers. 4. Disposable thermometer. Answer: fresh flowers. Rationale: fresh flowers can harbor mold and bacteria, posing a risk to immunocompromised patients. 21. A nurse is preparing to perform oral suctioning for a patient with droplet precautions. What is the most appropriate personal protective equipment (PPE) to wear? 1. Gloves only. 2. Surgical mask and gloves. 3. Gown, gloves, and surgical mask with face shield. 4. N95 respirator. Answer: gown, gloves, and surgical mask with face shield. Rationale: droplet precautions and the risk of splashes during suctioning require full PPE, including eye protection. 22. During shift change, which patient should the nurse see first? 1. A patient with enforced site change due in an hour. 2. A patient with a new onset of purulent wound drainage and fever. 3. A patient who needs discharge teaching. 4. A patient requesting a PRN pain medication. Answer. A patient with a new onset of purulent wound drainage and fever. Rationale. This may indicate an acute infection that requires immediate assessment and potential isolation. 23. A nurse is donning PPE before entering a contact isolation room. Which sequence is correct? 1. Gown, gloves, mask, eye protection. 2. Gloves, gown, mask, eye protection. 3. Gown, mask, eye protection, gloves. 4. Mask, gloves, gown, eye protection. Answer. Gown, mask, eye protection, gloves. Rationale. This is the correct order to ensure full protection and minimize contamination during donning. 24. A nursing assistant asks if they can care for a patient with active tuberculosis. What is the best response by the nurse? 1. Yes, just wear gloves. 2. No, only RNs can care for TB patients. 3. Yes, if you are fit tested and trained to use an N95 mask. 4. Only after getting a TB vaccine. Answer. Yes, if you are fit tested and trained to use an N95 mask. Rationale. Fit testing is required to ensure safe use of N95 masks during care of airborne precaution patients. 25. A patient is admitted with suspected meningococcal meningitis. What is the first action by the nurse? 1. Begin 4 fluids. 2. Apply a surgical mask and place on droplet precautions. 3. Start antibiotics. 4. Obtain a lumbar puncture kit. Answer. Apply a surgical mask and place on droplet precautions. Rationale. Preventing the spread of infection is the priority before diagnostic or treatment interventions. 26. A patient with an indwelling urinary catheter has cloudy urine and suprapubic tenderness. What action is most important? 1. Notify the provider. 2. Increase fluid intake. 3. Assess for signs of sepsis. 4. Remove and replace the catheter. Answer. Assess for signs of sepsis. Rationale. Infection may have progressed. Assessing for systemic involvement ensures timely intervention. 27. Which action by a nurse requires correction when performing hand hygiene? 1. Using warm water to wash hands. 2. Rubbing hands for 10 seconds with soap. 3. Drying hands with a disposable towel. 4. Turning off the faucet with a paper towel. Answer. Rubbing hands for 10 seconds with soap. Rationale. Effective hand washing requires scrubbing for at least 15 to 20 seconds to remove pathogens. 28. When can a nurse discontinue transmission-based precautions for a patient with MRSA? 1. When wound appears dry. 2. When antibiotics are completed. 3. After 2 negative cultures taken 24 hours apart. 4. When the patient no longer has fever. Answer. After 2 negative cultures taken 24 hours apart. Rationale. Clearance of MRSA must be confirmed through negative cultures before lifting isolation. 29. Which item is appropriate for reuse after cleaning in a hospital setting? 1. Suction catheter. 2. Disposable thermometer. 3. Blood pressure cuff. 4. Bedpan liner. Answer. Blood pressure cuff. Rationale. Reusable non-critical equipment can be disinfected between patients, unlike single-use items. 30. The nurse is assessing a central venous catheter dressing. Which finding indicates the need for immediate action? 1. Dressing change due in 12 hours. 2. Transparent dressing intact. 3. Purulent drainage at insertion site. 4. For tubing changed yesterday. Answer. Purulent drainage at insertion site. Rationale. This suggests a possible central line-associated bloodstream infection, CLABSI, requiring prompt intervention. 31. What is the most appropriate nursing intervention to prevent ventilator-associated pneumonia, VAP1? Keep patient NPO. 2. Perform oral care with chlorhexidine. 3. Avoid suctioning. 4. Limit fluid intake. Answer. Perform oral care with chlorhexidine. Rationale. Regular oral hygiene with antiseptic solution reduces bacterial colonization and VAP risk. 32. A nurse is assigning rooms. Which 2 patients can safely share a room? 1. A patient with HIV and a patient with neutropenia. 2. A patient with MRSA and one with diarrhea of unknown origin. 3. A patient post-op day 2 and one with cellulitis. 4. 2 patients both colonized with MRSA. Answer. 2 patients both colonized with MRSA. Rationale: patients with the same infection or colonization can be cohort when other factors align. 33. A nurse observes a student nurse placing a soiled gown on a counter in the hallway. What is the appropriate response? 1. Ignore the action. 2. Place the gown in a red biohazard bag. 3. Instruct the student to reuse the gown. 4. Discard it in a linen bin. Answer: place the gown in a red biohazard bag. Rationale: soiled PPE must be disposed of in designated biohazard containers to prevent environmental contamination. 34. Which practice violates sterile technique during a dressing change? 1. Reaching over the sterile field. 2. Wearing sterile gloves. 3. Using sterile solution. 4. Opening a sterile drape without touching it. Answer: reaching over the sterile field. Rationale: reaching across a sterile field introduces risk of contamination and breaks sterility. 35. What action is essential before collecting a sputum culture for suspected pneumonia? 1. Give the patient breakfast. 2. Ask the patient to rinse mouth with water. 3. Provide mouthwash. 4. Suction secretions first. Answer: ask the patient to rinse mouth with water. Rationale: rinsing the mouth reduces oral flora and helps ensure accurate culture results. 36. A nurse should avoid delegating which task to unlicensed assistive personnel, UAP, for a patient on contact precautions. 1. Feeding the patient. 2. Taking vital signs. 3. Changing the central line dressing. 4. Assisting with hygiene. Answer: changing the central line dressing. Rationale: this task requires sterile technique and clinical judgment and must be performed by a licensed nurse. 37. Which action by the nurse helps prevent transmission of infection during home health visits? 1. Use client's towel to dry hands. 2. Wear shoe covers. 3. Bring minimal equipment in a clean bag. 4. Wear full PPE for all clients. Answer: bring minimal equipment in a clean bag. Rationale: carrying limited, clean supplies helps reduce cross-contamination in home care settings. 38. Which intervention best prevents skin breakdown and infection in incontinent patients? 1. Apply antibiotic ointment daily. 2. Use a barrier cream after cleaning. 3. Limit fluid intake. 4. Turn patient every 4 hours. Answer: use a barrier cream after cleaning. Rationale: barrier creams protect skin from moisture-associated breakdown and reduce infection risk. 39. A patient with varicella, chickenpox, is hospitalized. Which visitors must be restricted? 1. Grandmother with prior infection. 2. Child previously vaccinated. 3. Parent with unknown immunity. 4. Nurse with a positive titer. Answer: parent with unknown immunity. Rationale: only immune individuals should be allowed near patients with airborne contagious diseases. 40. A nurse is teaching a family how to care for a wound at home. Which instruction is most important to include? 1. Apply hydrogen peroxide daily. 2. Clean with sterile gloves. 3. Wash hands before and after wound care. 4. Leave wound uncovered to air dry. Answer: wash hands before and after wound care. Rationale: hand hygiene remains the single most critical factor in preventing wound infection at home. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.